And surgery can be a process. Depending on the type of procedure, it can often last hours and is followed by weeks or months of recovery time.
But with advancements in technology, many hospitals, including Gunderson and La Crosse, offer robotic surgery. It's an alternative to the traditional methods with benefits to the patient both during and after.
News 19's Mackenzie Amundsen scrubbed in for us this morning. She's live at Gunderson, where we're getting a look at the procedure, which I believe now is getting underway, right, Mackenzie?
That's right. Good morning, Dustin and Brittany. I am in an operating room at Gunderson Hospital where a hernia surgery is taking place. But it's not just any surgery, it's happening with robotics. I'm joined by Dr. Dana Bendon, who's also a surgeon here at Gunderson. She's worked on over 1,000 cases that have had to do with robotics. Last time you checked in with us, the patient was just getting prepped. Dr. Bendon, what's happening now behind us with Dr. Smith?
So Dr. Smith is sitting down at what we call the surgeon's console, and what that allows is he's looking into a three-dimensional viewer. So what he sees is just like if the patient were open. He sees all of the structures in 3 dimensions, and he's able to take some hand controls and foot controls, and he's doing the operation while the patient is over just a little bit to his side, and the robot is now docked to instruments that are attached to his abdominal cavity, and he's moving those instruments and doing his dissection to start the hernia part of the surgery.
And so maybe we can give you a look over here at some of the robot. We won't zoom in too close at the monitors just in case you're eating your breakfast this morning, but you wouldn't believe how clear the image is with the robotics.
Yeah, robotics offers basically like watching a high-definition TV versus an old black and white, so you can see everything very clear, which really helps to decrease blood loss because you can see small little blood vessels that are there and coagulate them before they bleed. It also allows us a really precise view of what's going on in the abdominal cavity while Dr. Smith is doing his dissection.
And so once this is wrapped up, this patient will be able to go home. That's one of the benefits of using robotics.
Yeah, with robotics, patients recover a lot faster. The majority of our patients are maybe in the hospital overnight or are able to go home the same day.
Excellent. Well, thank you so much for being with us, Dr. Bendon. We're going to toss it back to you for now. We might check in one more time as this surgery continues.
Yeah, Mackenzie, do you know how long this hernia surgery is going to take? They just started a little while ago.
So I understand that this procedure could take 2 to 2.5 hours. However, the procedure itself is about an hour, hour and a half.
That is fascinating to watch as Dr. Smith there. You see him making the hand motions like he were operating on the patient right at the table there. Mackenzie, we thank you and we hope to check back in with you in just a bit.